Hi there, and welcome to Let's Talk About Health. I'm Dr. Madeline Mant, and today we're speaking to Sarah Granger, who has generously agreed to talk to us about her work as a standardized patient. So welcome, Sarah.
Hi, how are you, Dr. Mant?
I'm super well. Thank you so much for being here.
Oh, thanks for having me.
So let's get right into it. What is a standardized patient?
Okay, well, thanks for asking. A standardized patient. I do standardized patient work for the Center for Simulation-Based Learning at McMaster University. And according to McMaster University's definition, a standardized patient is a healthy person who is trained to realistically and accurately reproduce a history, physical, and/or emotional medical scenario that a real patient would present. Standardized patients provide faculty and students opportunities to teach, assess, and refine a variety of skills, including communication, interview, diagnostic, and clinical skills. So, what does that mean?
Yeah.
Let's
That was my
unpack that a
question.
little
Like,
bit.
okay, what does that all mean?
So, as a standardized patient, we provide a broad range of scenarios to essentially simulate what a real life interaction in the medical world might look like. So these scenarios can range from like psychosocial issues such as abuse to physical conditions. We are also sometimes brought in for clinical skills assessment. So then that's when we're also like physical models where medical practitioners may also like physically do assessment on us also. So essentially, why is this important? It's important because standardized patients are instrumental in creating patient-centered care approach to doctors and patient interactions. In addition to helping medical students develop and strengthen their skills in things like history taking or physical examination, professionalism, communication, and even something like compassion and empathy. So one also thing I want to note is, so I do work for McMaster internally with their medical school, their School of Nursing, but I also do standardized patient work externally for things like the Medical Council of Canada, the Canadian Alliance of Physiotherapy Regulators, the Pharmacy Examining Board of Canada, and the Optometry Examining Board of Canada.
Okay, that's incredibly varied. So how different is it when you're doing something like an optometry exam to one of the other exams you were discussing?
That's a great question. So optometry is really interesting because those are your eyes. Like you can't probe those. So with optometry, it's very much scenario based. So my character might come in and say, this is what I have been feeling, or this is what I have questions about, or this situation happened, can you help me? And the students, the candidate, that's what we refer to them in the exams, they then, based on what the STEM they're given in the situation, so the basic outline of what they're walking into, they will then go through their checklists and ask us questions, give different recommendations based on what they think they're hearing from us.
Okay.
But we are only probed to give information based on buzzwords we hear. So they could get a whole unique situation, but as long as my performance is standardized, as long as my performance is the same for everyone that I see that day, I'm ensuring quality assurance, at least, because I'm making sure everyone is at least set up with the bare bone framework to succeed in that opportunity, in that exam.
Right.
And it's up to them to essentially create what can happen from there. So that's like optometry side. So optometry is very interesting because it can kind of be its own kettle of fish. In regards to something like maybe the pharmacy exam, pharmacy is interesting because a lot of the time it is looking for recommendation. It's looking for, how do I use this? Or I've been told to come here, but I'm not sure why I was told to come here. So those ones I feel they're more hands off.
Okay.
Where something maybe like physio is a little more hands-on. That's where we're that physical model for the candidate. I think that answers the question. I hope
absolutely. No, it's so fascinating. So to make sure I'm understanding, you have a script, you have a framework, you have a character that you've prepared, and then you wait in a room and a medical student comes in and talks to you. Like, what's the kind of physical setup for this?
Oh, that's a great question. So yes, we set up tracks, if you will.
Okay.
And so usually we do this at, sometimes if it's at McMaster, if it's an internal exam, it'll be at the Center for Simulation-Based Learning, and they'll set it up that there are maybe a floor. So a floor is sectioned off with all these different rooms, 20 different rooms.
Wow.
And a candidate will be in there reading their synopsis that they've been given for this station that they have to work through. We ourselves, as the actors, as the standardized patients, we will be in another holding area until a timer goes off. And sometimes these are really quick interactions. Sometimes they're 7 minutes, sometimes they're 14 minutes.
Wow. Okay.
Yeah, so it's like we got to be on our game, ready to go. And we kind of really have to like jump into the heart of the issue, if you will.
Yeah.
So when that timer goes off, that's when we then wait on the other side of that closed door. When we are given our usually it's a wave, and then we go on in and we give our opening line. We have an opening statement we must give to every interaction we have, and then we proceed with whatever questions and scripted answers we have from there. That's one type. Another type is I'm in the room waiting for the candidate to come in. Those ones would be more for the physical exams. And when I say physical exam, they're not, like if I'm doing the physio exam, they're not actually going to really be maybe adjusting me or like pushing hard on me as if we were actually in maybe an actual doctor's office. They, for instance, may only be touching and aligning their hands and saying to the assessor who's also in the room with us, this is what I would do in this situation, based on the evidence I'm presenting or the reactions I give. So in terms of setup, it is essentially like a track style, and we rotate. So either I go in and then move on to another candidate, or I'm in the room and then the people just kind of filter through.
Okay. Now I'm interested a little bit, you talked about the STEM questions and the sort of key or buzzwords. So are there times when it gets awkward where the candidate isn't asking you the right questions? How much of how many clues can you give them as to what they should be finding out from you?
Yeah, that's a great question. So the exams are definitely more structured versus like an in-classroom setting where I have also had the opportunity to do some of that. If it is an in-classroom setting and maybe the only scripted line I get is my opening line and everything else is kind of up to me, again, as long as everything is consistent and standardized for everyone, in those situations, it's really kind of up to me as to how I'm going to be able to get information across. So in those situations, I usually get those basic kind of checklist questions, and I reply accordingly. So, do you have time to exercise? What's your diet like? Do you smoke? Do you drink? Have you traveled anywhere recently? Are you on any medications? And then based on the character I've been given and my opening remark and ultimately what my end goal is in that interaction, I will answer accordingly.
Okay.
Now, sometimes in those classroom settings, because they're a little more open-ended, you could say they're a little more vague too. Sometimes it's like it could take as long or as little as it needs to get there. And those ones are interesting because I can jump in a little more if I'm noticing that the conversation's starting to die a little bit, or I see that the student, I don't want to say struggling, but maybe they don't necessarily know what their next question is. I can jump in and like give something, be like, oh man, like it sure is hot today. Are you really hot and burning up? I don't know. Like maybe I'm running a fever, like, you know.
Okay, so sometimes a little bit of.
Sometimes. And though in those classroom settings where they're not being assessed, when they're not being examined, right? Now, having said that, like it does depend on what you've been given in the background. But we can say that is an example. Okay. In the exams, when they are very structured, those ones you do feel a little bad for because I can't say anything. I can only give my opening line, and I'm only allowed to repeat that once, kind of, right? Go in, say my statement, sit down, and wait for them to get at it. And if they're on the right page, I'm allowed to say or ask certain questions. Okay. Back to the timing piece. So if a station is 7 minutes, at a 5-minute mark, I have to give another prompt. So I'm also listening for that. So that can also be a saving grace sometimes if we notice that maybe a candidate is like really taking their time about something, or they've been silent for those 5 minutes. Right. As soon as I hit that 5-minute mark, that's my cue to be like, all right, let's get some talking happening.
So can you pull back the curtain a little bit? Can you give us an example of a character that you've done? Because this sounds really fascinating, but I'd love to have sort of one to sort of frame this on.
Okay. Let me think. So a character I have done, um, I have done one where someone is seeking information. They were given a particular medication
Hmm.
and they do not know really how to use it. And they're kind of laissez-faire about it. They're like, oh yeah, I guess like I have to take it. And they're kind of not as invested maybe in becoming well as one would have hoped. And so that particular situation would be maybe at a pharmacy or at a walk-in clinic.
Okay.
And then it's like, yeah, I was given this, but I'm not really sure why I need it. And then it's up to the candidate to like assess me on a basic like health history,
Hmm.
but then also to assess like, well, why was she given this? Okay, let me just like check out your profile. And sometimes they're actually given those resources,
Okay.
like a dummy profile. But then even with my tone and mannerisms, like you get this more in the classroom one sometimes where you can actually take the time to unpack the character a little bit. Sometimes you get people saying like, hey, what's going on with you today? You seem a little, are you down? Are you okay? Is everything going on all right? So those ones are kind of interesting. So that's one type. I've also had other ones where you're there on behalf of someone. Oh, I'm here to get information because my child did X, Y, and Z.
Okay.
Um, or I've also had other ones where it's like, yeah, not really sure what's going on, but like it's so obvious as to what's going on, but you just kind of play a little dumb.
Okay. So I'm hearing there's some where it's a specific medical issue that they should be trying to sort of figure out. And
Right.
in other cases, it might be trying to probe a little bit more for some of the background and some of the social issues that maybe were going on.
Yes. Yeah, that's
Okay.
a really great way to put it.
No, that's really interesting. It sounds really powerful. But what I'm hearing is a lot of improv skills that you need. So can you talk a little bit about how did you get into doing this? Like, how does one become a standardized patient? What sort of skills might you need to become one?
Sure. So, how I personally became a standards patient, it was really like right place at the right time. I was doing a show at McMaster, and I had met with the head of the theater department, and they were helping me design a set for a show I was working on. And they themselves were one of the trainers for the standardized patient program.
Hey.
And they had an actor drop out for an exam coming up in a few weeks, and they asked me if I would help, and I was like, yeah. And then that's how I kind of got into it. But
Mhm.
I'd heard about the program from like other friends of mine who had been standardized patients. In terms of skills, so for myself personally, yes, improv, theater, performing
Yeah.
skills definitely have been a huge advantage. Um, and I'd say, yeah, it's really important the consistency factor when you're a standardized patient. So even the basic fact of like, if you're performing, if you're taking on a role, you're that same character night after night, and having that consistency has really helped me be a standardized patient and perform, if you will, perform this role multiple times over.
Mhm.
Sometimes in a day, if I'm doing an exam, I perform the role 40 times over for different candidates. And by the end of it, you're like, what's my line? What's my affect? What's my,
Right.
have I had water today? Like, I
Yeah.
don't know.
How am
You kind
I,
of forget.
Sarah, not the character doing now? Yeah, I imagine there's a lot of challenges
Exactly.
keeping yourself separated as well.
Exactly. And you know what? That's actually the next point I wanted to bring up. So that's a good thing too. Another thing I have really found having the background in theater is I can shake off a character. Sometimes I take on roles that are a little more emotionally draining,
Mhm.
and sometimes they require tears or like just a frown all day, or like you're glum or really low disposition. So having that ability to then at the end of the day like step out of that character and leave that character behind in the space I've occupied all day is really helpful. Now, having said that, you don't have to have a background in theater to do this role. Honestly, I feel that if you have a background in medical anything, that's good too, because there are also what they call HPs, which are healthcare practitioners, and
Okay.
they're also really important for the exams because sometimes they get to interact with the medical practitioners that are like taking the exams or in the classroom, but they get to like talk shop with them because they know what they're like being assessed for. So that's also very important to have. I think honestly, in terms of like terms of skills or things that may really help anyone, regardless of background with standardized patient work: attention to detail, a good memory, listening skills, communication skills, or standard things like that. But I think like a willingness to dialogue with each other, with students, to kind of like understand maybe why they said a certain thing, and having a compassion and empathy, because it is a learning environment you're in. And one of my trainers said this to me once, and it was really kind of profound for me in that moment. We're learning, we're all learning, and with the standardized patient work, it affords the student the opportunity to make a mistake. So if they say something that's maybe not as PC, if they use your wrong pronouns, if they misdiagnose, they're in a training area where we at the end of the day can forgive them, but also correct them and take it forward so that they can be better going out into the world, right? So they cause a different type of harm, if you will, right? It's different. It's a safer space. It's a safer space for all of us to work these dialogues out, these cases out, these scenarios out.
Well, I like hearing that, the idea of the safer space in the classroom and in the exam, but also safer space for future patients when it will be real and the issues will be real, and these issues will be very, very important, particularly in that sort of, it's an intimate setting. So that's super interesting to hear, because I'm really interested in questions of language. And so one major thing in anthropology of health we talk about is how we use certain words and how they might have a slightly different meaning within an anthropology of health. And so when you hear words like health and illness and sickness and wellness, how do you understand those, or how are you using those through your work as a standardized patient?
Yeah, definitely. Language is so coded. It is so powerful. A few thoughts that I have on that. So as I mentioned, we are given our cases, and within it, there's different end goals and different words we're allowed to say, or answers we're allowed to give.
Right.
And it's interesting because I have found, and it does depend on the exam or the classroom I've been assigned to, but I found that the majority of the cases I get, there is something wrong, which in turn is associated with illness and sickness. So those words are always wrong. They're always the thing that needs to be cured. It needs to be stopped. It needs to be fixed. They're things we no longer want, we're tired of, we're frustrated with. And in those situations, it's always like me as the patient seeking assistance to rid myself of this supposed problem. And the solution sometimes is advice, or sometimes it's a product recommendation, depending on the exam, depending on the classroom. So I definitely feel that like words like illness and sickness are things that have been associated with things that need to be cured and resolved, battle against, and there usually isn't a positive connotation associated with these words when I'm doing exams, or when I'm just even having a classroom setting with the medical students. And it's funny because they always like, they're so adamant that, oh, it's okay, I'll cure you. Oh, it's okay, I'll fix you. Thank you for sharing this with me. It's like, I appreciate your enthusiasm, I really do. But like, there's also like the over enthusiasm. Oh, we're gonna really cure you and we'll rid you of all these things. But it's like, okay, you have 7 minutes to do that. And it's interesting because then to go with that, words like health or words like wellness are often the ideal that those students try to get us back to. And so it's interesting because there are the checklists where it's like, what's your diet like? Do you have time to exercise? And when, as the standardized patient, when we answer those questions, we usually get like the, okay, good. If they're like positive answers, my diet is well balanced. Yes, I have time to exercise. So those are kind of like, oh, they quickly say, oh, good, and proceed through their checklist. But I've gotten weird side eye before if I happen to say I'm a social drinker. And that's not something that's usually flagged as a problem in any of my cases. It's just like the fact that, well, this is my standard answer to this question. I'm a social drinker. There's nothing on it. But it's interesting because even if that is not part of the station, even that is not the thing that they're here to cure me of, the medical student always like comes back with something with unsolicited advice to bring me back to this baseline level of what
Okay.
we feel is healthy, of what we socially believe is health, but like from whose perspective is this health, right?
Yeah.
So I've also found, and again, it depends on the type of case, it just depends if it's an exam versus a classroom setting. I find that blame often gets in with
Right.
words regarding sickness, illness, health. And that I find is so interesting. Blame because, oh, I have let myself become ill, or I was somehow negligent, or maybe I was just looking after my toddler who went to school who picked up germs from another toddler, right? Or I'm praised if I appear to be quote unquote healthy or doing things that somehow align with maybe that medical student's idea and vision of health.
Right.
But I say something that they may not feel is healthy, and then I get this interesting advice or things that are not even professional to say sometimes, which then goes back to my point earlier about it is a safe space to explore some of these thoughts and why we think these thoughts and why we feel this is okay to say. Yeah, those are kind of my thoughts on those words.
Yeah. No, that's a really, really, thank you for that. That's a really fascinating reflection on that. And what I'm hearing is, personal definitions of health kind of interacting with these professional definitions, potentially of the kind of biomedical system, along with the fact that a patient and practitioner interaction is a relationship, it's a dialogue, it's a dance, it's all of those things. It takes two people to have it, but you're two people almost never have exactly the same opinion on something. So I think it's really, really useful to hear you saying we're giving people a chance to work out some of these. They could be biases, they could be prejudice, it could just be an innate sense they've never questioned, but it's a chance to work on that. And it gives you an assessor and you and them, the three of you, I guess, the chance to kind of talk about it. That's really interesting. And it brings back the idea that just that language is powerful and that language has meaning, sometimes even beyond the words we think we're using. But I guess my final question then is just, like, I want to do this now. How can I be a standardized patient? I mean, I like performing. I like those things. I have an okay memory. But what advice would you give for somebody who says, yes, who watches this video, hopefully, and is like, this is what I want to do. I want to help out with this.
Well, that would be wonderful. And yes, like standardized patients are always welcome. That's great. I will admit, because of COVID-19, right now things are on pause,
Mhm.
like with so many other things. But when we're out of that, you can definitely look at standardized patient programs at different universities. So
Mm.
some that I know, the University of Toronto has a standardized patient program, and a quick Google search actually takes you to their website where you can find how to apply to become one. They do go through a formal application process as if it is a job, but other than that, it's a very quick and easy process. McMaster University, as I mentioned, their Center for Simulation-Based Learning. You can go there and also apply. McMaster also has a Niagara campus that is a part of this. Brock University and Niagara College are also other institutions that you can get involved with, and they do the internal practices, so like within their own nursing programs or med
Right.
school, but then they also do the external, so the exams. But you don't have to have a background in performance, as I mentioned. They also look for the healthcare practitioners. And so, yeah, so those would be my like immediate knee-jerk look for these places.
Yeah.
But I also heard a while back that standardized patient, and I don't know if they still call it that for different fields, but like test audience standardized patient work is also done sometimes with like product development, and
Whoa.
then also law school testing out like juries or what clients you may get. So I've heard it used in many different realms.
Okay.
So Google, I feel, would be the best source to direct you in things.
As with most things, you should probably
Yeah.
Google it. But that's really, really helpful and amazing to hear that there's so many programs for
Mhm.
if a student from UT, for instance, wanted to get involved in something, there's lots of different resources they could find pretty easily. But that is super fascinating. I didn't know that you might need them for law as well, but that makes a lot of sense.
I know, it blew my mind. I was like, please, yes, I'll do all of that. Thank you.
Yeah, seriously. Well, thank you so much, Sarah, for sharing your expertise today. This has been utterly fascinating, and I know I've learned so much.
Well, thanks for having me. I appreciate it, Dr. Mant.
Oh, absolutely. But thank you also to the audience for tuning in today. And I want to say thank you, everybody, for your attention, and we'll see you next time on Let's Talk About Health.